Good morning, everyone, and welcome to this morning's webinar, Managing the Risk of COVID-19, What an Inspector Looks For. My name is Kate Mahiris. I'm a Director of Regional Operations here in Health and Safety at WorkSafe Victoria, and this morning I'll be your host for this webinar. While our program this year is virtual, we still have the same aims of Health and Safety Month, and that is to keep you up to date with all the information you need in your workplace. Our focus this year is navigating through COVID-19. So this morning, we're going to have a conversation between myself and our three expert speakers, which I'll now introduce. Cheryl Carrick is an inspector in the Health and Safety Business Unit. Good morning, Cheryl.
Morning, Kate, and everybody else who's joining us today.
Thanks. Yeah, excellent. We do have a lot of viewers this morning. Tony Heathcote is also an inspector in Health and Safety. Good morning, Tony.
Yeah, good morning, Kate, and good morning, everyone.
Thanks, Tony. And finally, Bronwyn Haste is a senior occupational hygienist and an inspector here in Health and Safety. Good morning, Bronwyn.
Morning, Kate. Hi, everyone.
Excellent. So welcome to the three of you. So we've structured this session, as I mentioned, as a conversation between myself, Cheryl, Tony, and Bronwyn. So there's going to be a lot of information we're going to go around about. Talking about managing the risks of COVID-19 in the workplace, and in particular, what inspectors are looking for should they be entering your workplace. So just some minor housekeeping matters before we get into it. If you'd like to join the social media conversation, just use the hashtag HSMonth. And at the end of the session, we will provide you with a list of resources that you can go to as well. So let's begin. The WorkSafe Inspectorate visits workplaces across the state in industries as diverse as manufacturing, health, retail, education, agriculture, and construction. Inspectors work with employers and others in the workplaces to keep Victorian employees safe. Since the beginning of the pandemic, our team has been conducting their usual work, inspecting workplaces to ensure all Victorians go home safely every day. Transmission of COVID-19 can occur in workplaces, and employers need to ensure that they are identifying the risks and implementing controls to eliminate or reduce the risk. The work of the inspectors that you're going to hear from today has also been challenged by the pandemic. So Tony, I'm going to start with you this morning. Can you explain to the viewers how the Inspectorate has adjusted their way and their work during the pandemic? What's different for you now?
Yeah, thanks, Kate. Yeah, like all other workplaces, WorkSafe had to really rethink how we conduct our work, including how inspectors are protected from the COVID-19 virus. Normally, we would attend workplaces in person, but where there are reasons why it may not be safe for us to do, we've been making our inquiries remotely and also gathering information remotely so that we can better understand whether the workplace is complying with the law. Our new ways of work have included inspectors using a screening tool to help conduct assessments before entering the workplace. And in addition, we try and meet in open spaces. Sometimes that's outdoors. We plan inspections in advance to limit the time spent at a workplace. And WorkSafe have also provided us inspectors with training on hygiene practices, along with ensuring that we have adequate supplies of PPE at all times. And in Kate, earlier this year, we really increased our focus at workplaces on the COVID-19 risks. So while we've maintained our usual inspectorate functions, we've also had to refocus on sites with higher risks, such as meat and poultry processing, construction, food manufacturing, health practices, and warehousing, just to name a few, to ensure that these workplaces are reducing the risk of the employees being exposed to this virus. And this has included ensuring that Victorian workplaces have implemented a COVID safe plan that addresses all risks of spreading the virus from one employee to another. And if a workplace has employees who are out on the road, your COVID safe plan must also include strategies on how you're protecting these employees while they're visiting other workplaces, Kate.
Yeah, excellent. So I'm going to come back to you on COVID safe plans later on in the conversation because I know that there'll be a lot of people watching with questions around that. Perhaps now, Cheryl, if I come over to you, could you briefly talk to us about what workplaces need to be thinking about when managing the risk of COVID-19? Where do I start?
Yeah, so like a lot of workplaces, WorkSafe has to adapt very quickly to develop and implement risk strategies for COVID. The Chief Health Officer has developed workplace directions under the Victorian Health and Wellbeing Act and the emergency powers. And the purpose of these directions is to limit the number of people in workplaces to assist in reducing the frequency and the scale of outbreaks and to establish obligations on employers and employees. And there's been a little bit of a misconception that by meeting the Chief Health Officer's directions, an employer is meeting their OHS obligations. However, that's not always the case. The Chief Health Officer's directions are intended to supplement any obligations that an employer has under the OHS Act and are not intended to derogate from any existing OHS obligation. So workplaces need to ensure that they're meeting the workplace directions and their obligations under the OHS Act.
So that's a lot of information there. Maybe if we step back, what are the health and safety laws, though, that employers at the very basic level need to be adhering to?
Yeah. So an employer's duty in relation to the transmission risks of COVID at a workplace should be treated like any other risk at a workplace. And that's to eliminate, and if that's not reasonably practical or not possible, then they need to reduce those risks so far as reasonably practicable.
So eliminate or reduce. So I guess what we've heard from Cheryl, though, we have two laws here, though, in regards to managing the risk of COVID, and employers need to be aware of both of those. Bronwyn, can I ask you now to perhaps step us through a bit more information about what are some of the differences we need to be conscious of in between those the workplace directions, as Cheryl mentioned, and the Health and Safety Act?
Yeah, sure. Thanks, Kate. So the main difference with the OH&S Act is that it only applies to workplaces, and there's duties on employers to identify and control all hazards and risks and manage those risks. Whereas also the OH&S Act is not prescriptive, so employers can tailor the controls that best suit their workplaces. So they're not following a set of prescriptive controls which might not necessarily suit them. Whereas the Chief Health Officer directions are actual laws that can't be modified or adjusted, and they must be followed by everyone, not just workplaces. And they are only for controlling risk of transmission of the COVID-19. So, so if workplaces are following the Chief Health Officer directions, then they are also meeting their legal obligations under the OH&S Act to ensure that their workers are safe and as far as transmission of COVID-19 goes.
So thanks, Bronwyn. So there are some similarities, but also some differences we need to be conscious of. Tony, if I come to you, I understand a key requirement of the workplace directions is to have a COVID safe plan, which you mentioned before. If I have that, is that enough to be compliant with the Health and Safety Act?
Yeah, no, not necessarily, Kate. As everyone knows, the OHS Act requires employees to provide a workplace that is safe and without risk to health and safety so far as is reasonably practicable. Developing a COVID safe plan is a very important first step. However, providing monitoring and ongoing supervision just as important and just as critical as the plan itself. And importantly, when identifying hazards and implementing risk controls, employers must ensure that they're consulting with the employees. Consultation has always been an obligation employers must comply with. However, more than ever in these times of employee anxiety and business uncertainty, it's even more important that workplaces involve all employees when reducing COVID-19 risks.
I think, Cheryl, if I come back to you now we know a bit more about the legal obligations, which is important, and workplaces need to be aware of that. Can you tell us what is the role of inspectors such as yourself and Tony? And when you walk into a workplace, what are you actually looking for?
Yeah, okay. I'll do my best, Kate. So an inspector's role is very varied, but our primary function is to visit workplaces and ensure compliance with the acts and the regulations that are administered by WorkSafe. A large part of our role is to also provide advice and guidance to workplaces. And the main thing inspectors want to ensure is that employers are meeting their OHS obligations to either eliminate or reduce hazards and risks. And as you've heard, at present, we have a focus on COVID-19. However, that doesn't mean that when we go to workplaces, we won't address any other hazards and risks that we identify when we're there. There are typically three main ways an inspector will attend a workplace. So we have strategic visits, which at the moment we have the COVID-19 blitz that we're doing. The strategic visits have a very specific focus on particular types of industries and the risks in those industries that have been identified by WorkSafe. Incidents also that have been notified to WorkSafe, we attend those, and any health and safety concerns that have been raised with our advisory service. And these concerns can be raised by a health and safety rep, an employee, or a member of the public. And anybody raising those concerns can remain anonymous if they choose to. So, for example, in a warehouse, we are looking at things like traffic management, forklift and pedestrian movement, whereas in a hospital, that risk doesn't really exist. So our focus is really more in healthcare settings on, say, manual handling and occupational violence. For COVID-19 risks, what we want to ensure is that workplaces are reducing their risks. So we're looking at the systems, and those systems include screening, hygiene, cleaning and disinfection, physical distancing, record keeping, the use and provision of PPE and training on the PPE, and also consultation. So the employers are consulting with their workforce.
I think you did really well. There is a lot in your role every day when you walk into a workplace. Tony, if I can come back to you as an inspector, what are some of the common COVID-19 safety issues that you're coming across? And also, if I can sort of split the question, what are employers doing? What are some of the changes and improvements they're making in the workplace to deal with those issues?
Yeah. The good news is, Kate, that most workplaces have adapted very quickly to COVID-19 risk reduction strategies, which has been good to see. Things that can be quickly resolved and often with very little cost. Examples being things like the removal of shared coffee cups and plates from the employee lunchrooms, or ensuring that rooms have been assessed for maximum numbers permitted in each room. And these are some of the simple but very effective things that we expect to see in all Victorian workplaces. As Cheryl said, we typically look for things like physical distancing, correct use of face coverings and other PPE, daily disinfecting of high-touch items, and training for employees. Unfortunately, a very common contravention we're seeing is insufficient training being provided to employees, as well as a lack of monitoring to see if employees are complying with the workplace COVID-19 strategies that have been put in place for them. It's a key obligation for workplaces to ensure that all employees not only know that there's a COVID safe plan in place, but also that they understand it and can follow the requirements.
Yeah, thanks, Tony. So a lot of good information there for workplaces, I guess, to think about. And we'll probably come back to that consultation piece a little bit later, as I'm keen to understand that a bit more. So Bronwyn, if I can come to you now, I understand your role is a little bit different to Cheryl and Tony. As a senior occupational hygienist, you're often involved in developing guidance for workplaces. So can you talk to us about some of the guidance that's been developed, but also, what is it important for employers to think about in that space?
Yeah, thanks, Kate. Sure. So initially at the start of the year that we did a lot of research and collating that information and developing guidance for workplaces. And we wanted to provide information on, how the virus is transmitted and also what are the best risk control strategies for them. So we had to look at all the different types of workplaces, because there's obviously different risks of transmission in different workplaces, and tailor the guidance for the different types of workplaces. So some of the guidance we created was, for example, retail store, and where you've got to look at the risk of interaction with customers who might be infected, or also perhaps if customers are trying on clothing, whether they've infected that clothing and how you manage that. So obviously the risk with that is quite different than when you look at healthcare settings. So then you've got staff interaction with patients, which could be, quite close contact interaction, face-to-face interaction, and you've got potentially infected or known infected patients, so much higher risks there. So we created quite comprehensive guidance on respiratory protection equipment in that situation. And then again, when you look at manufacturing, and in particular production lines, because there was quite a few outbreaks on those production lines, and in those situations they can't do things like physical distancing, so we had to look at what other controls they can implement. So so if you refer to our WorkSafe website, all the guidance is available on there, and there's also guidance available on DHHS website, and Business Victoria have got heaps of information You can also contact our advisory service for any information COVID related.
Yeah, super. And we'll put the links up to all of those websites Bronwyn mentioned at the end of the webinar. So Cheryl, if I can come back to you, I understand there's been some specific questions asked of inspectors and WorkSafe in regards to a specific workplace direction that is under those Chief Health Officer directions you talked about. It's around, what if I have a suspected or diagnosed case of COVID in my workplace? What obligations do employers need to think about, and what should they be doing?
Yeah. So, Kate, first and foremost, if there is a suspected case or a confirmed case at a workplace, the employee needs to support that employee. And that, excuse me, will also include advising them of their workers' compensation rights. Protecting the rest of the employees is also really important. And it's okay to let your employees know that you do have a suspected or a confirmed case. And it's just as important to let them know how you're responding to that case. As you said, the Chief Health Officer's directions also include obligations wherein there is a confirmed or suspected case, and so those things need to be followed. Employers also need to be aware that the government at the end of July introduced Occupational Health and Safety COVID-19 Incident Notification Regulation. So these regulations require an employer to notify WorkSafe of any positive COVID cases for employees and contractors at their workplace. But really the most important thing is about talking to your workers about what is happening in the workplace, because that's going to allay any fears or any concerns that they have. So it's really important that as an employer you remain open and transparent with your workforce.
Yeah, excellent, Cheryl. So communication and consultation is key. And Tony, I told you I'd come back to you on consultation. Why is it so important?
Yeah, it looked like everyone's been saying it is a key obligation, but not every workplace understands how to actually comply with it. Workplaces should foster a cooperative, consultative and collaborative relationship with employees in relation to health and safety, and this includes contractors and labour hire employees as well. Kate, it's been in my experience that when you see an increase in consultation in the workplace, you also see an increase in employees complying with their health and safety rules and requirements at that workplace, which is good to see. And while we are the regulator under the OHS Act, we also have an accountability to provide information and guidance to workplaces. We have a very well-trained advisory service and advisory line, as Cheryl mentioned before, and that they're always available to Victorian workplaces. So our advisory service can provide workplaces with practical tools and resources to help reduce workplace risks and comply with the law, and they're only a phone call away.
Yeah, excellent. So there'll be a lot of information that employers can access in that space. Tony, Cheryl and Bron have agreed to share a bit of a case study with you in their role and what they've seen. So these are real life scenarios, obviously with the finer details removed. So Tony, I might start with you to talk us through your case study that you wanted to share today.
Yeah, look, obviously there's been a few, but this workplace had a few hundred employees, so it was quite large. And I was very impressed with how quick this workplace had adapted to COVID-19 risks, and it implemented some very, very simple risk reduction measures, and they were measures that I'd never come across before. So when I'd asked how they'd come up with these very simple ideas, I was told that every one of those ideas had come from employees out in the warehouse itself. And they went on to show me with a huge sense of pride how extremely cheap each idea was to implement. And the good thing is I've since visited many other workplaces where the simplest of solutions have actually been generated from the shop floor.
Yeah, wow, that really hones in on your point around consultation and how important it is. Tony, but can you give us, perhaps to share with us, what's a risk control that you saw in that workplace? Can you give us an example of how practical it can be?
Yeah, sure. I was inspecting the employee lunchroom at a workplace, and I'd seen that they'd placed red masking tape on the floor to mark out a 1.5 metre perimeter around things like the fridge and the microwave to illustrate how much distance we must maintain when a person is using those items. And I've since seen other workplaces apply similar masking tape on the carpet 1.5 metres out from desks in an open office plan to illustrate the minimum distance that must be maintained from one another. And then another idea I had come across that was suggested by an employee was that this workplace had purchased these quite cheap large white hooks and attached them to the doors, so that the doors could be opened using the inside of your elbow rather than physically grabbing it with your hand and possibly transmitting the virus unknowingly. So you'll be amazed at the solutions they come up with.
Yeah, wow, some really little pieces of gold there that Tony's just shared for all of you viewing at home. So Cheryl, if I come to you, can you talk us through a case study example that you've seen?
Yeah, sure. So I attended a small manufacturing workplace with only about 20 employees, and that was part of our strategic COVID blitz. So while I was at the workplace, I observed that they did have the systems in place for COVID. So they had screening for employees and they were documenting the screening that they were doing. They had a cleaning and disinfecting regime, and I was able to see documentation around that. They had hand sanitizer at the entry to the workplace and dispersed throughout the workplace. They were providing PPE such as masks and gloves, and they provided training, and I was able to see evidence of the training that they had provided. However, when I asked about a COVID safe plan, which is required under the Chief Health Officer's directions, they didn't have one. And basically they told me that they weren't aware that they had to have one. So what I did, and this comes back to the role of the inspector where we do provide advice and guidance. So I was able to point them into the direction of where they could obtain a template for a COVID safe plan, and just sort of let them know that if an authorised officer from the Department of Health and Human Services was to attend, then they would expect to be able to see that COVID safe plan. So I advise them that to download it, complete the COVID safe plan, and then share it with their employees.
And Cheryl, you mentioned training in the use of PPE. So it's one thing to supply it, but why is training so important when it comes to personal protective equipment?
Yeah, so PPE is a really important part around COVID. So it's really important that people understand how to take on and take off their PPE, because this helps to stop the spread. Employers should be providing instruction and training in the use of the PPE and when and how to use it, just as they would for any other risk in the workplace that requires PPE to be used. So the Department of Health and Human Services, WorkSafe and Safe Work Australia has guidance on their website that will assist employers on providing this information to their employees. And for workplaces such as in the healthcare sector, there is very specific guidance around how they need to put on and take off their PPE.
Yeah, excellent. Thanks, Cheryl. And finally, over to you, Bronwyn. I understand you've got quite an interesting case study to share with us.
Yeah, thanks, Kate. So there was a concern raised at a travel booking agency about that the risk of control of transmission of COVID was not being controlled. And so when we looked into it, you've got to look at what the risks of transmission are at that workplace. And it's different to a normal retail store, because normal retail store, the customer comes in, walks around. But at a booking agency, you've got the face-to-face interaction with someone, and it could be for 15 minutes or more, which then becomes a close contact under the DHHS definitions. So you need to look at what further controls could possibly be implemented in those situations, and consider screening of your customers, perhaps whether you ask them a questionnaire before they enter the store or as they're entering the store about whether they've been unwell, or perhaps even do temperature checking.
Okay, so you just mentioned something around 15 minutes face-to-face contact. What does that mean? Why is it important?
Yeah, thanks. Well, the 15 minutes has actually been defined by DHHS as a close contact, as well as there's another one, 2 hours in the same enclosed environment as another person who is infected. And this is because the risk of transmission or infection is much greater, because to actually contract the virus, you have to exceed a certain load or concentration of the virus. And they're saying this 15 minutes face-to-face, you're getting that higher load, so the risks are much greater.
Bronwyn, any sort of final comments that you want the viewers to think about today?
I was just going to say that controlling hazards doesn't always have to be expensive and time consuming, and sometimes the simplest controls are often the best.
Fantastic. And Tony?
Yeah, look, I'd certainly agree with exactly what Bronwyn said. And if I was going to single out one item based on the inspections that I've done, it would have to probably be just supervision and monitoring, just making sure that, whether you implemented your plan a month ago or 3 months ago, but just that ongoing monitoring of ensuring that the employees are following the plan and following the directions.
Yeah, super. And finally, Cheryl, your final message for today's viewers.
Yeah, final message from me is communication and consultation. It is just so important, not just around COVID, but around all things in the workplace, and engaging with your workforce. Because as Tony said earlier, the employees generally will have the best ideas.
Okay. Thank you, Cheryl. So we're going to now wrap it up. Thanks all of you for coming this morning. On our screen shortly will be some resources that you can go to, those website links we mentioned where you might want to go and ask some further questions or get more information. So thanks so much for tuning into today's webinar. I hope you have a great day.